other aspects as well. If we look at chronic viral infections, for example, we can see that there are studies that support the use of the immune system as a means of helping patients who are suffering from chronic viral infections such as HIV. There have been some studies, clinical studies that have been produced in Canada and also in Australia, whereby individuals who are sufferers of HIV and have reached a stage where they're going to full-blown AIDS, that's acquired immune deficiency syndrome, have been treated by having their identical twin provide their immune system back to support the immune system which is failing as a consequence of chronic HIV infection. And what you see in those individuals is a strong level of support, such that those patients who were at a stage of having full-blown AIDS, that is less than 200 CD4 cells per microliter of blood, have actually returned to near normal levels of CD4 cell populations for very long periods of time. So they've stopped the full-blown AIDS and the movement towards complete loss of immune system and protection from opportunistic infections. Another area which is quite interesting that has been studied is the idea of actually laying down immune cells from people who are early in the onset of HIV infection. So that is taking their immune cells, cryogenically preserving them at a time early in the onset of disease. And this is a study that was done by a group in Sydney. And what they demonstrated is that should those individuals then go on to progress in their disease to a level where they're going to onset of AIDS, they can actually reinfuse those immune cells back into those individuals and again get a quality response for a sustained period of time, for at least several months, which stops them going back into the level of acquired immune deficiency syndrome. So all in all, there are a number of approaches with immune therapies that are highly supportive of boosting or being able to boost the immune system in ways to offset chronic viral infections and neoplastic diseases such as cancer.